So in this video, we'll see some terms and their difference, like tranquilizer, and there is one more term, we call it atactics. And there are two more terms, we call them neuroleptic or antipsychotic. So these four terms, and then sedative and hypnotics. So in today's lecture, we'll see the meaning of these four terms and will make a difference between these four terms and the sedative hypnotics. So starting with these two terms, neuroleptic and antipsychotic. These two terms, they are used in human medicine. These two terms, tranquilizer or atactics, they are used in our veterinary medicine. So the first difference between these four terminology, that neuroleptic and antipsychotics, they are used in human medicine. Tranquilizers and atactics, they are used in veterinary medicine. So before going to their meaning, definition, mechanism of action, we'll start with the journey with neuroleptic or antipsychotics. As these two terms, they are used in human medicine. So initially, these two terminology, first time they were used. They were used to describe the effect of phenothiazine class of drugs. So these two terms were used to first time they were used to describe the effect of phenothiazine group of drugs. So these phenothiazine groups of drugs, they were developed and they were used. Where they were used? They were used in human beings. In human beings, these things were used for treatment of some mental illness. What kind of mental illness? That mental illness was schizophrenia. And this schizophrenia is an example of psychosis. So this was the history or the story of these drugs, where neuroleptic or antipsychotic, these antipsychotic, the first members were your phenothiazine class of drugs. These were used to treat psychosis. Which psychosis? Schizophrenia. Schizophrenia is a kind of psychosis or mental illness. To treat the psychosis, we used antipsychotic drugs. So phenothiazine were the first group of drugs used to treat psychosis. So we call them antipsychotic. Or the other synonym for them was neuroleptic. So what is schizophrenia, or what is this mental illness? In case of human beings, we'll see first mental illness. In case of human, mental illness is of two types. One is called psychosis and one is called neurosis. This is not narcosis, it is neurosis, and this is psychosis. Psychosis means insight is absent, and neurosis means insight is present. What is the meaning of insight absent? It means the patient itself, they don't know that they are sick, they are ill. But in this case of neurosis, insight presence means the patient itself knowing that he is sick. So if you try to give medicine to a psychosis patient, he think that I am a normal or am very okay and am healthy. They think that they are normal, but in reality they are not normal. They are sick or ill mentally. This comes under the category of psychosis. So psychosis patients are having absence of insight, means they don't know that they are sick or ill. They feel that they are perfectly okay, normal and healthy. But in case of neurosis, the patient itself know that he is sick, and not only he is sick, he goes to doctor to take some medicine. So what are the example which comes under the psychosis? Psychosis is of two types. One was schizophrenia. So this was the disorder, a psychosis or a mental illness for which your phenothiazine class of drugs they were used for the first time as antipsychotic for the treatment of schizophrenia. And the other psychosis category is your mood disorder. The mood may be overactive, means they are aggressive, or mood may be depressive. Overactive mood is called as mania. That is called as mania. And depressed mood is called as depression. That is called as depression. So mental illness is of two types, psychosis, neurosis. Our phenothiazine class was developed mainly to treat psychosis. So we call them as antipsychotic drugs, neuroleptic drugs. Which psychosis disorder was corrected? Schizophrenia. Other psychosis disorder may be mood disorder. Overactive mood is called mania, that is your aggressive of the animal, and depressive mood is your simply depression. Then what is a neurosis? That is inside is there. The patient itself knows that he is sick and he goes to doctor. That one example is in your medicine book also given bulimia. That is eating disorder. Eating disorder. Either the animal eats or eat less. So in this case, in this neurosis case, itself the animal or a human being patient is knowing that he is sick because he is overeating or undereating. But the psychosis where the patient is mentally ill and he thinks that he is perfectly normal and okay. So two class of disorders comes under psychosis, schizophrenia and mood disorder. The mood may be overactive, aggressive, we call them mania, or mood may be depressed, that is depression. So this was the schizophrenia for which our phenothiazine group of drug were developed or discovered to treat the schizophrenia. So what is schizophrenia? In case of schizophrenia, there is something dopamine problem. That is, dopamine is in excess. Dopamine is in excess. So, how to treat this dopamine excess? The answer is use of some dopamine blocker drugs. If you block the receptor, then dopamine will not be able to stimulate, or not only dopamine excess, if there is overstimulation of D2 receptor. In that case also we use D2 blockers. So the whole story theme is in case of schizophrenia, there is dopamine excess. So to treat that schizophrenia, the mental illness, we use a dopamine blocker drug. Your phenothiazines, which were the first member, their main action is dopamine antagonist, and they were used to treat the schizophrenia. That is, they act as antipsychotic drugs. So these antipsychotic drugs, they are of two types. One is typical antipsychotic and another is atypical antipsychotic. Typical and atypical. Typical means they are weak D2 blocker. They are There are some weak D2 blocker and there are some strong D2 blocker. So the class of drug which comes under weak D2 blocker, they are phenothiazines, because first time phenothiazines were used for the treatment of schizophrenia as an antipsychotic. So they are weak D2 blocker, phenothiazine. Then what are strong D2 blocker? There is one another group of drugs, butyrophenol derivatives. Butyrophenol derivatives. They are strong enough. Then these phenothiazines, they are of two types. One is low potency and one is high potency drug. One is low potency drug and one is high potency drug. There are only two examples. One is CPZ, chlorpromazine. This was the first phenothiazine which were used as antipsychotic in human medicine. So this is used in human medicine. But for veterinary purpose, we have a drug APZ, or in some book they write ACP, acipромazine. So there are two drugs which are of low potency phenothiazines. They are weak D2 blockers, and there is only one drug of high potency that is used in equines, or we call it flufenazine. Flufenazine. So there are three examples in the phenothiazine group of drugs, only three examples, two of low potency, CPZ and APZ, and one is of high potency, that is flufenazine, and this is used in equine. So these 1, 2, 3 drugs, they are phenothiazine drugs. They are weak D2 blockers and they are used as antipsychotic. Then we have some strong D2 blocker drugs. They are butyrophenol. Again, we have three phenothiazine, we have three butyrophenol drugs. One is your haloperidol, H for human being. It is only used in human being, haloperidol. Then there are two drugs, droperidol and one is azapirone. These two drugs are used in veterinary medicine, where azapirone, this is your sedative of choice in case of pig. So antipsychotics, which are typical or atypical class of drugs, typical are D2 blocker mainly and atypical are 5-HT2 blocker mainly. Mainly means their more action is on D2. This class of drug, they also have some anticholinergic action, alpha blocker, M blocker or H1 blockade and others. But their main action is on D2. And this atypical antipsychotic main action on 5-HT2. So typical, atypical antipsychotic. Then these are of two types, weak and strong. Phenothiazines, as if you see whatever drugs they have discovered, the first generation drugs are always weak drug. Then we go to second generation, we develop some more strong drug, more potent. So they are of low potency, weak drugs, phenothiazine. Strong D2 blocker, butyrophenol. Only three examples, CPZ, APZ are low potency, flufenazine high potency. Butyrophenol again, three examples, haloperidol for human being, or droperidol or hexapyron for veterinary medicine. Hexapyron for as a sedative of choice for your pig. This was the MCQ in NET exam 2021, 2020 NET exam. That sedative of choice for your pig as a pyron. So we'll start our discussion with phenothiazine group of drug, that is D2 blocker. Then we'll go towards the butyrophenol derivatives like your haloperidol, droperidol, and azathioprine. So the first class of drugs were your phenothiazine group. They were developed as antipsychotic and used in human beings. So what is their mechanism of action? They have multiple mechanisms. But out of these multiple, if someone asks what is the main mechanism of action, then your answer will be D2 blocker. This is main. Other mechanism of actions, they will give you side effect. Alpha 1 blocker action. If you block the alpha 1, that will lead to vasodilation, and vasodilation means hypotension. So this is the side effect more commonly seen with your phenothiazine, because they block the alpha 1, which lead to vasodilation, hypotension. Then second is anticholinergic effect. Anticholinergic means they block the M receptor. The next H1 blocker effect. First, these antihistaminic that may lead to sedation. And next is your 5-HT serotonergic inhibition, and the last is they decrease seizure threshold. They decrease seizure threshold. So these are the mechanisms of your phenothiazine group of drugs. The main mechanism is D2 blocker. Other are alpha 1 blockage, cholinergic receptor blockade, mainly M receptor, H1 receptor blockade, serotonin blockade, and they decrease seizure threshold. So first we'll see what is seizure threshold decrease concept. Then we'll start our main mechanism like D2 blockade. There are two cases. One is normal and one is your chlorpromazine administered patient. In this, if you stimulate the brain from any kind of stimuli, suppose seizures come at 90 millivolt. This is the threshold value. This line is threshold. If you this is 90, and if you stimulate the brain more than 90, then there will be seizures, convulsions. But in case of chlorpromazine, this threshold value from 90, it decreases to 60. Means in the normal healthy animal, seizures or convulsions will come if you stimulate by a power of 90. But in case of chlorpromazine, it decreased the threshold to 60 Now with a little stimulus, with very little stimulus, that is a stimulus of 60, what precipitates seizure. So this is the difference or the main mechanism of what we said, that the decreased threshold of seizures. Means normally seizures, if they come at 90, then after giving your chlorpromazine, seizures precipitate even at 60, even at 50, even at 30. So a little stimulus may precipitate seizures. So this is the meaning of lowering the threshold for seizure with the chlorpromazine. So phenothiazines are contraindicated in epileptic patients because already they are having seizures. If you use the phenothiazine group of drugs, they reduce the threshold and worsen the problem. So phenothiazines, as I told you, they have multiple mechanisms like D2 blocker than others. So we'll see the first mechanism, the main mechanism, that is blockade of D2 receptor. D2 receptor are blocking dopamine receptor. Okay. So first we'll see what is dopamine. What is the role of dopamine in the brain of an animal? So dopamine regulate motor activity. Dopamine regulate motor activity of the animal. Dopamine regulate behavior of the animal, and then vomiting. This mechanism, vomission, is present only in human and dog. In case of ruminant like cattle, buffalo, sheep, goat, and horses also, there is no dopamine mediated vomiting effect. It means if you use the D2 blocker drug, then the anti-emetic action, that anti-emetic action will be produced only in case of human being and dog. So this vomission mediated effect through the dopamine is present only in human and dog. So the dopamine regulates many functions like vomission, like behavior, some motor activities. So first we'll see where this dopamine is present in our brain, what are the pathways through which it regulates the motor activity, the behavior and vomission. If we block these activities, then our purpose is solved. So we are going towards the tranquilizer or their tranquilization action. In case of brain, inhibitory neurotransmitter is your GABA. Dopamine is not an inhibitory neurotransmitter. Dopamine is not an inhibitory neurotransmitter. There is one exception to this. Dopamine at the level of pituitary inhibit prolactin release. But overall, at the level of brain, dopamine is not an inhibitory neurotransmitter. So what is the main inhibitory neurotransmitter of our brain is GABA. So this was the first point, that dopamine is not an inhibitory neurotransmitter. There are two places where you find dopamine neurons in animal body. Where these dopamine neurons are present, and what function they are doing there. So this is the pituitary and this is the hypothalamus and this is your cerebellum and this is the part of your brain and this is your uh, olfactory lobe. Olfactory lobe. So this part is known as your midbrain. This is your pons and medulla oblongata. So in the brain of an animal, there are two places where dopamine neurons are present. Mainly two pathways. One is at the level of hypothalamus. In the hypothalamus, there is semicircular arc-like nucleus is there. So this is arc-like, we call it arcuate nucleus. Arcuate nucleus. Some neuron having cell body here, they move and they enter pituitary intermediate lobe. Here they release dopamine, which will inhibit prolactin release. So this is the first portion where dopamine is present and acting as an inhibitory substance. So in the hypothalamus, arcuate nucleus having cell body here, axon moves into the intermediate lobe and release dopamine that inhibits the release of prolactin. So if we are using phenothiazine group of drugs, D2 blocker, then they will block this pathway. They will block the D2 receptor. Then the side effect of phenothiazine group of drugs will be increase in prolactin. Increase in prolactin. That may lead to galactorrhea as a side effect. So this is the mechanism with it first with the D2 blocker phenothiazine group of drugs. And the second, the main pathways which we are discussing as their tranquilizer effect for the restraining of the animal, they are situated at this place. At the level of midbrain or we call mesencephalon. In case of midbrain, there is one nucleus having these cell bodies. These cell bodies give their axon to this structure which is called striatum. And they come at this striatum. This nucleus is called substantia nigra. Substantia nigra. And this is striatum. So the first pathway of your dopaminergic neuron is called as nigrostriatal pathway. This is nigrostriatal pathway. Out of all the pathways, majority of dopamine is present in striatum. And what is the role of this pathway in the body of animal? This pathway controls motor activity. This pathway controls motor activities. Then similarly, there is one more nucleus and that nucleus is having cell bodies and we call it VTA, ventral tegmental area. This nucleus also sending the axon to two places. This portion, outermost part of any structure, we call cortex. In ovarian cortex, in brain, cerebral cortex. So this is our cerebral cortex, and here we have something called limbic system. So from the VTA nucleus, dopaminergic neuron come at this place. Some neuron from this, they go to the cerebral cortex. So the second pathway is called meso, because starting with the midbrain, mesencephalon, we call it meso going to the cortex. So mesocortical pathway. And this third pathway is starting from the meso going to limbic. So meso-limbic pathway. So what is the role of studying all these pathways? These are dopaminergic pathways. Three pathways. Start with the mesencephalon, midbrain, and first will end up into the striatum. So we call it nigrostriatal pathway. Second, start with the VTN nucleus, means which is a part of mesencephalon. So mesolimbic pathway, mesocortex pathway. So what is the role of these pathways? The role of first pathway, nigrostriatal pathway, maintain, mediate, coordinated motor activity. Limbic system is related with your behavior of the animal. Cerebral cortex gives its fiber to striatum and limbic system. So this is the superior part where dopamine also goes. So it is controlling both. So if we block this pathway, nigrostriatal pathway, then movement will not be there. It means in case of animal, we are using a term restraining. What is the meaning of restraining? Your animal is not allowing you to touch. He is moving. So because of that, more movement of the animal. In case of cat, they are doing so much motion. And the second thing, behavior. Their aggressive behavior. We call aggressive behavior. So to restrain an animal, what we want to immobilize the animal. Either you want to take a blood sample. So what you want to immobilize the animal so that we can easily take the sample. Second, we want to reduce the aggressive behavior so that the animal will not bite us, will not scratch us, or will not cause any harm to our body. So these two components we want to suppress. So to suppress these components, we are what we call restraining of the animal. At least these two components. If you look at the anatomy of the brain, where these two components are present, what is the anatomy and physiology? These two components are related with your dopaminergic pathway. Where the behavior component is present, your mesolimbic pathway. So if you block this mesolimbic pathway with your drug, then that behavior will be reduced, and what we call the animal is calm. Anxiolytic. Animal is calm down. The aggressive behavior is, but still the animal is aware. That is a good thing. Animal is calm, but he is aware of the surroundings, what's happening in the surroundings. So if you break this pathway by using your phenothiazine group of drugs, by using your butyroshinon group of drugs, if you block the D2 receptor, you block this pathway. The pathway is related with the behavior. You calm the animal, anxiolyze the animal, but still he is aware of the surroundings. So one component of restraining is done. What is second component? Excess movement. Which pathway is related with the movement? This nigrostriatal pathway. What is the role of this pathway? It controls all the motor activity. So if we block this pathway, then the movement of the animal will be reduced. There will not be any movement activity. The muscles will relax. And you can perform your diagnosis or any like X-rays, any other diagnostics. So in case of restraining, these two pathways we have blocked. One is behavioral pathway and one is your movement pathway. And the mesocortical pathway is the superior pathway which sending its fiber to here and here. So if you block this pathway, both purpose can be solved. So this is the tranquilization effect in case of animal, where we use the drug as a tranquilizer for restraining purpose. So at the anatomical level, we block these pathways. And these are your dopaminergic pathway. These are not your GABAergic pathway. Because GABA is negative inhibitory neurotransmission. So if we look inside these pathways, here we have pituitary, hypothalamus, arcuate nucleus, fiber going here, and they're releasing dopamine that inhibit prolactin release. This is your substantia nigra. Fibers are going into the striatum. We block this, no movement. This is the VTA. They are coming to the limbic system. That is behavior. We also cut this. Then behavior animal becomes calm, no movement, and these some other pathways are also there, like amygdaloid body. Some fibers come to olfactory lobe, but they are not very important at this point of time. And for restraining, because the majority of the dopamine is present in this part, your striatum. Maximum dopamine is here. Other places dopamine is there, but that is less important. This is the main point. Then in case of human beings, there is something more important, that is your CTZ. CTZ is also having some receptor called dopamine receptor. So dopamine acts at these receptors. Then what comes? Vomiting. So if we block these dopamine receptors, then there will be anti-emetic effect. So the phenothiazine group of drugs, acetaminophen, chlorpromazine, haloperidol, droperidol, all these drugs, they have D2 action at CTZ. They block the vomiting, gives you anti-emetic effect. So inside this brain, if we look at the striatum and we bring one neuron out, this is the neuron, and suppose this is your next neuron, because there are some synapses. Tyrosine enter into the nerve ending. Tyrosine becomes dopa. Dopa becomes dopamine. It is filled with the vesicles. So the neuron is filled with dopamine. Where action potential comes, it will release dopamine at the next neuron. Here dopamine receptors are present. We call them D2. So the job of our drugs, like our phenothiazine group of drugs, butyrophenone group of drugs, they will block at this point. They are D2 blockers. They block at this level. So no neurotransmission, the action stop at this level. So this stoppage of neurotransmitter through blockade of your D2 receptor, it's happening at these three places. One is your striatum, one is your limbic system, and one is your CTZ. And what is the result? Anti-emetic effect. Behavior decrease, animal becomes calm. And if you block this, then movement or motor activity decrease. Relax the muscles. So this is how your phenothiazine, butyrophenones, your tranquilizers, they calm the patient, they relax them, and you can restrain them very easily. So this was the mechanism, which was the main mechanism that we discussed, D2 blocker, where dopamine is present, which are the pathways, how dopamine is secreted, if we block, what kind of response are there, and how did we restrain our animal. So other than D2 blockers, they also have some mechanisms like alpha-1 blockade. If you block the alpha-1, then there will be vasodilation. And vasodilation may lead to hypotension. And body do not want hypotension. So body will react, reflex, lived by reflex. What reflex is there? We call reflex tachycardia. So this is the compensatory mechanism of our body. But what the drug is doing, drug block the alpha-1, drug is causing vasodilation, drug is causing hypotension. But this part is not by the drug, this is by the body as a compensatory. So if they ask you what is the side effect of your phenothiazine group of drugs, alpha-1 blockade. The side effect is hypotension. There is one more concept related with alpha-1 blockade. These are the blood vessels which are having alpha-1. So if we block, then what happens? Vasodilation. Suppose there is cold weather, there is winter. In case of winter, what animals do? They do vasoconstriction. Why? To preserve body heat. Because in winter, they do not want to lose the heat. So to preserve the body heat, they do vasoconstriction. So in cold or winter, if you use your phenothiazines, your butyrophenol types of drug, and if in that winter portion, if they block your alpha-1, then there will be vasodilation, and the body which was preserving its heat will not be preserved. There will be loss of heat. And if the body is losing continuously heat, then what comes out as a result? Hypothermia. So one side effect which is related with your phenothiazine group is hypothermia. So the first was vasodilation. So because of vasodilation, in case of cold or winter season, body wants to preserve the heat, so it constricts. But if you are giving this drug, it will vasodilate, and because of vasodilation, all the heat will be lost, and animal undergo hypothermia. The next other mechanism related with these drugs, they may be anticholinergic, like your blockade of M, H1 blockade, then seizure threshold decrease, and 5-HT2 blockade. So these are some other mechanisms. So if we compare these two group of drugs, your phenothiazine and your butyrophenol, they are the first discovered drugs. The story begins with phenothiazines. They were used in human beings as an antipsychotic for treatment of schizophrenia. So drugs which were developed or discovered first time, obviously they are weak. So they are weak D2 blockers. Then after that we develop something called strong D2 blocker. The difference between these two classes of drugs, their alpha-1 blockade is more, and their alpha-1 blockade action is mild. Because of this, hypothermia will be more and hypothermia will be mild. Their anti-emetic effect, mild to moderate. Mild to moderate. Why? Because anti-emetic effect is because of D2 blocker, and they are weak D2 blocker. So anti-emetic effect will be mild or moderate. but they are strong D2 blocker. It means their anti-emetic effect will be stronger than your phenothiazine. So these are some difference between phenothiazine and your butyrophenol derivatives. They are weak D2 blocker. Because of that, they are mild anti-emetic. Strong D2 blocker. Because of that, strong anti-emetic. More alpha blocker, so more hypothermia. Less alpha blocker, so mild or less hypothermia. So this is the difference between phenothiazine and your butyrophenol. Then there is one term, extrapyramidal symptoms, EPS, extrapyramidal signs or extrapyramidal symptoms. Extrapyramidal symptoms are nothing but a group of symptoms. These are a group of symptoms. Question is why they come? Why do they come? Because of the reason is because of excess D2 blocker. See, we are giving the drug to block the D2 receptor. No, we do not want excessive D2 blockade. If there is excessive D2 blockade, then a group of symptoms will appear. We call them extrapyramidal symptoms, extrapyramidal signs. So what are these extrapyramidal signs and why there is excess? This is the normal case where we have other neurotransmitter. Here we have dopamine. This is called normal. Everything is balanced. But if you look at the patient of schizophrenia, in that case, there is excess of dopamine. These are other and this is your dopamine excess. To treat the schizophrenia, we develop some antipsychotic drugs and we use them like our drug phenothiazine. We use them to decrease this dopamine and bring this dopamine into the level with others. So we have given our drug. Initially it was normal. In case of schizophrenia, dopamine increases. Then we gave our drug phenothiazine, butyrophenol. That again make it normal. But there are some drugs which are strong D2 blockers. Butyrophenol derivatives, yes, they are strong D2 blockers. So strong means they further like strong D2 blockers. They further decrease dopamine. They further decrease dopamine and other will increase. So this happens with the strong D2 blockers that not only they bring the condition normal, but if they further block the receptors because their nature is strong D2 blockade. So if they blockade more, then instead of normal, your dopamine levels will decrease. Because of this decrease, what comes out? Extra pyramidal signs. Because of decrease in dopamine, because of strong D2 blockers, extra pyramidal signs are seen. So what are extra pyramidal signs? There are 4 types of symptoms. We call EPS as group of sign or symptoms. The first which comes first, that is muscular dystonia. This is your earliest EPS. The first sign which comes as EPS is your muscular dystonia. So what is muscular dystonia? Muscular means muscle. Dystonia. Dys means alter. Tone means either increase or decrease. So in case of muscular dystonia, the muscle tone altered. If the tone increases, there is one example where muscle tone increases, we call it torticollis. So torticollis is an example of muscular dystonia as a symptom of EPS because of your strong D2 blocker. So the first EPS is muscular dystonia, altered muscle contraction or muscle tone. If it increases, we call this torticollis. So this was your first extrapyramidal sign, muscular dystonia, means alteration of muscle tone. Second is AKA, akathisia. Akathisia means constant, purposeless movement. The animal is moving constantly. The animal is moving constantly without any purpose. This is akathisia. And the third is there is one term, tardive dyskinesia. As your muscular dystonia was the earliest EPS, this is the EPS which comes late. How much late? After 3 months. And what is tardive dyskinesia? It is nothing but a movement disorder. It is a movement disorder. Onset is late. After 3 months, it may come. In some people, it comes after 1 year. In some after 2 years. So it is of late onset. This is movement disorder. And what is the reason why tardive dyskinesia occur? The reason is due to upregulation of your D2 receptor. Why upregulation? Because of continuous or chronic use of antipsychotics. If you use your antipsychotic drug for a long time, for a chronic period, then the D2 receptor will upregulate. That may give the condition tardive dyskinesia, a kind of motor or movement disorder. So these were 3 extrapyramidal signs, and why they come? Because of excessive blockade of D2. Why excessive blockade? Because of strong D2 blockers. So up to this point, what we did, we started our journey with phenothiazine group of drugs, which were first time used as antipsychotic for what? For some mental illness. Mental illness. Which mental illness? It was psychosis. Or which psychosis? Schizophrenia. Schizophrenia. What happens in schizophrenia? Dopamine increases. So what we use? Phenothiazine as D2 blocker to decrease the dopamine. So these drugs were called antipsychotic. These were called neuroleptic. So we covered up to this. We also covered with phenothiazine, the first was weak D2 blocker, and we also covered butyrophenol derivatives, which are nothing but strong D2 blocker. Because of strong D2 blocker, we also see extrapyramidal signs. What were those? Muscular dystonia, akathisia, and tardive dyskinesia. So we cover this much process. That was related with the term. And then with this D2 mechanisms, we have also seen that there are three pathways. That was your nigrostriatal, then mesolimbic, meso that through these pathways we reduces the anxiety, their movement, and restrain our animal. So dopamine is not a inhibitory neurotransmitter in the brain. It is performing some different functions. So now we will see some individual drugs. Individual drug means we have phenothiazine, we have butyrophenone, phenothiazine. Phenothiazine we have two categories, low potency drug and we have high potency. In high potency there is only one example, fluphenazine. Remember only the horses. This is example. In low potency we have CPZ, the first member we have APZ, aceclomazine. This is used in human medicine and this is mainly in your veterinary practice. And this is in horses. Butyrophenone we have haloperidol, we have droperidol, and we have your azapirone. Halo for human, dro and these two for vet. So first we'll see CPZ and APZ. What kind of drug, low potency drug they are. So in case of CPZ, the chlorpromazine, this is the drug which causes convulsions, which causes seizures. Then the second drug is your aceclomazine. The first MCQ with no analgesic action. This was the MCQ in NET 2020. That which of the following effect is true about aceclomazine? Answer is no analgesic action. Neuroleptics or tranquilizers, all the tranquilizers, they do not have analgesic action. So what we do, we combine them, these neurolept, we combine them with some analgesic drugs like opioids. And the combination is called neurolept analgesic. So the first MCQ was no analgesic action with the aceclomazine. Then the second MCQ is this drug. The same drug aceclomazine, the second MCQ was also asked in NET 21 and ICAR 2017. And that was related with the horses, and that is your penile prolapse, or we call it paraphimosis. Why this paraphimosis occurs? If we look at the animal, so this is the case where normally the penile tissue remain inside the prepuce or the sheath. There is one muscle. This muscle is known as RPM, retractor penile muscle. Because of this muscle, it retracts the penile tissue inside so that it will remain in its normal position. But somehow, if this muscle gets paralyzed, then the penile tissue, it will not be able to come inside the prepuce or the sheath. So this part which is outside, we call this penile prolapse. Why this penile prolapse occurs? Because of paralysis of retractor penile muscle. Why this muscle get paralyzed? Your AP chest, SA promagy. That may lead to consequences like RPM paralysis. That penile structure will not go inside, it will come outside, and this is an emergency condition. So this was the MCQ in ICAR net for 2017. That penile prolapse or paraphimosis in horse is because of AP chest. And the second MCQ was they do not have no analgesic action. These two MCQ related with the acetyl. So at the end, we'll see what is the difference between sedative, hypnotic, and your tranquilizer. We use the term tranquilizer or ataxic in case of veterinary medicine. And instead of these two terms, we use antipsychotic, neuroleptic in case of human being. So remove the human being term, we'll see what is the difference between tranquilizer and sedative. The first difference is they cause profound depression of the brain or drowsiness. But tranquilizers, they cause mild sedation. They cause profound sedation or depression or drowsiness, but they cause mild sedation. The second difference is related with the dose. Suppose we start with we are having like drugs like barbiturates and benzodiazepines like drugs. At low doses, they are sedative. If you increase the dose, they become hypnotic. If you further increase, they may go into deep sleep. If you further increase the dose, an animal becomes unconscious, and then anesthesia, that is anesthesia, then coma, and at the end, death. But these effects, by increasing dose, they are not same with your tranquilizer. If you increase the dose of tranquilizers, you are not going to come into coma, anesthesia. No. If you increase the dose, the animal becomes unconscious. But in this case, if you increase the dose, still your animal is conscious. That is the difference. The second difference is catalepsy. What is catalepsy? Which is nothing but muscle rigidity. Muscle rigidity. If you increase the dose, more muscle rigidity will be there. So the difference between the sedative dose-dependent effect is if you increase the dose, sedative, hypnotic, deep sleep. But in this case, there is unconsciousness. But if you increase the dose of tranquilizers, still they are conscious. And second is catalepsy, more muscle rigidity. This is the difference. And the mechanism of difference between your sedative, hypnotic, and tranquilizer. We have studied our benzodiazepines. We have studied barbiturates. Both were acting through GABA A. This increased the frequency. This increased the duration. And last we did alpha-2 agonist, your cyanazine type. So these were the mechanisms with your sedative and hypnotic. But these tranquilizers, which may be phenothiazine, butyrophenones, their mechanisms were D2 blockade, the main mechanism. Other were alpha-1, M blockade, H1 blockade, 5-HT blockade, and seizure threshold lowering effect. So sedative, hypnotic mostly act from these receptors, and they mainly act through dopamine receptors. The next difference between these sedative, hypnotic, and tranquilizer is the animal is unaware of the surrounding most of the time. Here the animal is unaware, but in this case the animal is very well aware of his surroundings. This is another difference between sedative and tranquilizer. Animal is unaware, where the animal is aware because it is conscious. And here there will be unconsciousness if you further increase the dose. And related with some reflex of the body, these sedative as they depress the CNS, so they depress or suppress both reflexes. Whether it is acquired means whether it is conditional reflex or conditional reflex. But they block only and only conditional reflex. Conditional reflex. Do not block unconditional. Unconditional reflex means like salivation or like respiration, sneezing or yawning. So these are unconditional. No need to learn. Whatever we learn throughout the life, they are conditional. But unconditional reflex, these reflex we get by birth, like sneezing, coughing. So they block only conditional reflex, unconditional not. They block both. And the last difference is not last difference, effect on MSH. Either no or MSH with your alpha 2 agonist like xylazine. As we know, the xylazine is emetic of choice in cat, but it also causes vomiting in dogs. But still, MSH effect will not be there either, or it will be because of alpha 2 agonist activity. But in this case, D2 receptor are present in your CTZ, there will be definitely anti-emetic effect. Anti-emetic. And the last difference between sedative and the tranquilizer is related with the DRC. Their DRC is steep and there is flat. Steep DRC means that they are less safe comparatively and they are more safe. So these were some differences between sedative hypnotics and tranquilizers. And the most important last difference is tranquilizer, no analgesic effect. Here may or may not, or you can say some sedative hypnotic have analgesic effect. Example, your xylazine. So some have analgesic effect, but here your net MCQ, right? They do not have analgesic effect. So if they don't have analgesic effect, we have some ideas or some methods to give them analgesic effect. Okay, this is your tranquilizer, which is having no analgesic effect, having only sedation effect. Okay, we combine something which gives it analgesia. What is that something? Opioid. Opioid give it analgesia, and the whole combination is called neurolept plus analgesia, because tranquilizer also known as neuroleptic. So the term used is neurolept analgesia. Because of the combination of these two, now our neurolept analgesic drug is having both properties, sedation as well as analgesia. 3 MCQ asked is on this topic in your ICAR 2017 on neurolept analgesic topic. We combine sedative property with analgesia. So what were the MCQ? The first MCQ was, all MCQs were on their combination. This side we have neuroleptic, your tranquilizer, plus this side we have opioid. So the first MCQ was, what is Innovavet? What is Innovavet? So this Innovavet is nothing but combination of droperidol, your butyrophenol, tranquilizer, droperidol, plus your opioid, fentanyl. So this combination was asked. That Innovavet is a combination of these two, droperidol and fentanyl. Other two MCQs were also asked in the same year, same exam, and they were Immobilon LA and Immobilon SA. These two are also example of neurolept analgesia. LA here means large animal, used in large animal, and this is used in small animal. So what is Immobilon LA and SA? So we'll finish our topic with Immobilon. If I write Immobilon LA or SA, used for large animal, used for small animal. In both the cases, one thing is common: etorphine. Etorphine is nothing but your opioid. Out of neurolept analgesic, the analgesic part is your etorphine, that is opioid analgesic part. That is common. But second component is different. Means in here also we have etorphine, and here also we have etorphine. But this component is different. For LA means large, or SA means small. From the name itself, you can derive your example. Just look at the second letter, A. A for APZ, acetylpromazine. Again, look at the second letter, M. M for MTZ. What is MTZ? Methotriprazine. This is the methotriprazine. So this Immobilon LA or SA, this is neurolept analgesic, and both these MCQs were asked in your 2017 exam. In both the cases, what is common? Etorphine. What is different? One is large for large animal, one is for small animal. Large in both the cases, if you look at the second letter, that will give you the answer. Large means LA, A for acetylpromazine. Small M for methotriprazine. So this was the neurolept analgesia. So first we started with phenothiazine group, that was used antipsychotic drug. Then we have seen their mechanism of action, how to restrain the animal. Then third, phenothiazine versus butyrophenol. Then individual drugs where APZ was causing penile prolapse. And number four, we have seen differences between sedative versus your tranquilizer. And at the end, because tranquilizer, they do not have any analgesic action, so we combine them with the opioid, and the combination was known as neurolept analgesic. Three examples or three MCQs were Innovavet, your tranquilizer group. Butyrophenol was iorazapirone. This was also asked in at exam 2021. That which of the following sedative of choice for the pig? to sedate the pig, sedative of choice, your as a parent. But in that, in one more exam, that question language was different. Anticholinergic, which anticholinergic is used to sedate pig? See, these phenothiazines or butyrophenones, they have D2 blockade action, they have anticholinergic action, H1 blockade action, and your serotonin. So anticholinergic action is also present. So they can design the MCQ like this: anticholinergic drug, which is used as a sedative for the pig, that your as a. So this was the topic where I have covered 6 MCQs. 3 from the neuroleptic analgesia and 2 MCQs from your APZ, that is no analgesic action, phenyl prolapse, and 6 MCQ from your pig. So this video cover 6 MCQ and many more.